Revolution, do not touch the dial. It's your daily tonic for healthy living. 7 minutes gone past 11 this lovely Tuesday morning, and I trust you're doing great. I am very okay. Let me ask, how are you today?
Fine.
Are you okay?
Yes.
Are you doing great?
Very.
I can see it's radiating all over you. And that's the spirit this morning. We are so energetic. We are happy. And like I would always tell everyone, whatever happens, just stay happy, okay? Stay positive, and it will radiate. It will show in your actions, in your attitude, and everything. There's a particular saying, I don't know if it's a myth, but they say the more you smile, the more you are ageless, the more you will not be too angry.
Yeah.
So please, you see today, whatever trap they set for you, put it aside. Just keep smiling, and they'll be wondering what's going on. So all these things I've been doing to this person, they even vex them.
It's not entering.
It's not entering. What's going on?
It's a bulletproof.
Yes, you have a bulletproof. Don has said it this morning. Just arm yourself, cover yourself with that bulletproof. Whatever arrows come, just smile through it, and they'll keep wondering what's going on. And that's you only trying to stabilize your mindset. Okay,
Yeah.
It goes a long way in ensuring that you are not depressed, or you don't come down with any form of, anger or aggression, whatever it is. Okay, good morning and welcome. My name, as always, is Mary Omeniwo. They call me the Slim Diva. You're most adorable.
And I am Judge Dawn Ikoma.
And together, we'll make your morning between now and 12. Quite interesting. DJ J-Boy is on the deck this morning, and no dull moment with him at all. Okay, so before we begin, let's start off with some health update we have for you this morning. And I stumbled on some information. Pediatricians have come up to caution the public, especially parents, and they have warned that untreated ear infection in children can progress into life-threatening complications, including meningitis, if not promptly diagnosed and properly treated. Now, they went on to explain that ear infections, which are very common among children, can spread beyond the middle ear when left unmanaged, potentially affecting surrounding tissues, and then it goes straight to the brain. They also noted that such complications may lead to severe conditions such as permanent hearing loss, brain infection, and in extreme cases, death. I don't want to go deep into what they said, but I believe they have passed on the message.
Yeah.
Now, from what I can see, the pictures they released, you have a pus coming out from a child's ear. In Igbo language, I know it is called, is it abunti or something? Yes, that's what it's called in Igbo. Quite very common. Some children actually pass through this, and some parents feel it's a normal face for a child. It's not a normal face. The moment you see this pus-like substance coming out from your child's ear, please do not take it lightly. I beg you in the name of God, okay? So that it doesn't progress beyond that particular ear and into the brain. And you know what it can cause. When it gets to the brain, then you start to run helter-skelter when you should have prevented it in the first place. And yet another update this morning, still by, coming from dermatologists this time around, but it still has to do with children. It still has to do with skincare. Dermatologists have come up to warn Nigerians against the use of lemon juice, brake oil, and other home remedies to treat ringworm, cautioning that the practice could worsen the infection and trigger secondary bacterial infection. Now, they went on to list possible complications to include contact dermatitis, hair loss, skin irritation, burning sensation, redness, and skin peeling. And then they went on to say that anything that has to do with ringworm or fungal infection, it requires proper antifungal treatment, noting that applying acidic or unregulated substances may go on to irritate the skin further and damage its protective barrier. I will not talk much. I've even seen someone use kerosene on a child with ringworm. Yes. And she said, that's how my mom used to treat it when we were growing up, forgetting that then and now is actually not the same. We are in two different eras. The time of our parents, way back then when we were still very young, and now is actually very, very different. So please do not resort to, yes, I know that you might want to, go straight to home remedies to care for some of these ailments. However, you could end up causing more harm than good. Do not use kerosene. Do not use petrol. Do not use brake oil, engine oil,
Nothing.
whatever it
Just go to the
is.
hospital.
Go to the hospital, or you just see a healthcare provider or practitioner, and they will prescribe antifungal
The
medications.
seasoned one anyway.
Exactly, for you. And the last update, secondhand smoke can increase ulcer risk in teenagers. Secondhand smoking. We keep talking about this all the time, but let's go straight up into what they have said. According to these child health experts, they have come up to warn the public that passive smoking, also known as secondhand smoke, may increase the risk of ulcer among teenagers, noting that constant exposure to cigarette smoke could heighten their vulnerability to the condition. Vulnerability, I beg your pardon, to the condition. Now, recent evidence has linked secondhand smoke exposure to a higher risk of peptic ulcer disease, even in non-smokers. I don't want to go deep. So it has passed on the message. For people who say, oh, nobody in my family smokes, I do not smoke. Even my children do not smoke. My son doesn't smoke. My daughter doesn't smoke. However,